My first experience in Ninewells was as a student nurse. I started my training in Dundee School Midwifery in 1973 and Ninewells opened in 1974, so I did quite a number of my placements there. When I qualified, I had my dream job, which was working in ear, nose and throat. And at that time the children were nursed actually in the ear, nose and throat ward, along with the adults in separate bays, and they would come in for minor procedures, the children normally, but some of the adults came in for fairly major surgery which had a very poor outcome and a very poor quality of life. They had lots of chemotherapy and radiotherapy treatment. However, in this time, these treatments are actually much more refined and less invasive and detrimental to the patients now. I also worked in places like plastic surgery, burns unit, and again the treatments nowadays, we very rarely see major burns in Dundee, but at that time we would have quite significant burns coming into the unit.
Okay, so I'm Wendy Warden. I am a registered nurse, qualified in 1990, so forever ago. So I've worked in lots of different places within Ninewells. The hospital's gotten much bigger, lots of new specialties, lots of advancements in technology. When I first qualified, we had paper in a handover that you just basically wrote down. Now things are printed, so that's a really nice advancement. So yeah, lots of changes, probably more technical than it ever used to be. Certainly the role of the nurse is very different. When I qualified, student nurses, and when I did my training, student nurses weren't supernumerary, so we were part of the workforce. So within the ward, if you went on shift, there would be two registered nurses and maybe 10 or 12 students. So students were the workforce, so that's how you learned how to be a nurse, just by doing rather than being a supernumerary, which is the way things are now. So there are lots of good things and bad things about both. Supernumerary means that you don't count in the numbers, if you like. So you're not, if you are part of the workforce, then if you need to pick up things that you maybe wouldn't normally. So as a student now, students are external, so there's a ward team and students are external to that. So they can observe or they can get involved in the learning, but if the ward's short-staffed, they can't be used as a pair of hands, if you like. Whereas when I was a student, we were.
I think some of the key things in the 50 years since Ninewells has been open is the world-renowned areas that it has moved in. So, for example, technology, keyhole surgery, robotics, all of these things now make life very different, both for the patients and also for the staff. In the laboratories, for example, many years ago it took much longer to do a test, and there was a bit more of a, if I could call it, a risk to the actual laboratory technicians, where now things are much more streamlined, tests can be back much quicker. Also, if someone, for example, now is coming for an X-ray, that result can be passed back to the GP, so it doesn't mean that the patient always needs to come back into hospital.
I think it's amazing to see how things have progressed in terms of, well, I was a patient in the early days of when Ninewells opened. I got my tonsils out in 1978, so I was there as a patient as a child. So I could see lots of differences and lots of really good things. You know, lots of advancements in what we can do, we have lots of robotic stuff in theatres that we can do. We do things differently. Patients stay in hospital for much less time, which is good. We want them to go home. That's where they should be. So being able to do that, laparoscopic surgery, keyhole type surgery we can do, and patients are only in for a short space of time. My specialty latterly was cardiology, and we used patients who would come in after a heart attack, they would come in and they'd be in hospital for 2 weeks. Now they're in hospital for 2 days. So significant changes, which is great. You want to be home, and patients should be at home.
My fondest memory is my patients. I can still remember patients that I looked after in the 70s, and I'll always remember them fondly. I remember people who are no longer with us, who I nursed, and it's lovely if, for example, you're walking through town and somebody stops you and says, "Are you Sister Dawn?" And I look at them and think, yes, I'm Sister Dawn, now who are you? Usually it comes back to me pretty quickly, but they'll say, in 1980, whatever, you looked after me, you were a nurse in the ward, you were the ward sister and you looked after me, and you looked after me very well. And that's a lovely, lovely feeling to have for all these people.
Probably one of the best days I remember being a nurse. We had a patient who was in a renal ward and was very unwell. He came in on the Thursday and his daughter was getting married on the Saturday. And he was very unwell and he wasn't able to go. But we were able to organise for his daughter and the whole wedding party to come into the ward on the day of her wedding after she got married. So he was able to see her. But it was bride in full wedding gown, new husband, best man, 5 bridesmaids, 2 little flower girls. Everybody was there, and we were able to coordinate that and to come into the ward, which is one of the nice things I remember about Ninewells, that we were able to do that. And it took a bit of organising, as you can imagine, just to kind of bring all these people in. I'm not sure we'd be able to do it now, but it was quite a long time ago. But it was a lovely thing to be able to do.